Good morning, everybody, and welcome. It's a very important day today. We are here in Hyderabad, India, celebrating International Day of the Midwives and listening to women. It's all about women and their experiences, and this year's theme is Follow the Data and Invest in Midwives. Now, the global world is looking to come together, and what better way than to start having this webinar to advocate investments in quality midwifery care around the world, which will improve sexual, reproductive, maternal, and adolescent health. Now, currently, we are in India facing one of the worst crises on the pandemic. Can I introduce our mothers? Anusha Bharadwaj is a mother of two. She's the founder of SoCh, a feminist and also a TED speaker. And as I said, listening to women is absolutely fundamental. Our second panelist is Muqaddas Sultana. Muqaddas is a mother of three, an educationalist, and a writer. The midwifery panelists are Anitha G, who is a midwife and started midwifery training in Fernandez in 2011 in the first batch of midwives. She has been key to the training in Telangana and a faculty trainer of the current midwifery training in Telangana. I would also like to introduce to you Sheetal Samson, a professional midwife. She's a national midwifery educator trainee, a mother of two herself, and passionate about improving maternal health in India, like all of us. So we are all on a mission. These are the scenes that we're seeing daily, and the number of deaths daily, and this is today's data. Mothers who are pregnant are frightened. So this is about mothers and also sharing how the professional midwifery team can help mothers. What have midwives done? This pandemic has started in March last year. And we know that the WHO states that if you have professional midwives trained to international standards, we can impact on midwifery care in India and impact preventable losses. I'm not going to read you the stats, but as you can see what the stats are, and they're very powerful stats because these are preventable. And one of the things that we want to talk and discuss with all of you is how can midwives change the landscape of birthing in India? So we will discuss this in our conversations with our mothers and our midwives, and how have the midwives been frontline workers during the COVID, and how can midwives impact on improving women's experiences? And you are going to hear it from our mothers, not from us. So that's going to be a real interactive session. And also to share, the government of India has also committed that we will have an additional 85,000 midwives by 2023. And what a great way to celebrate the start of International Day of the Midwives. We will also discuss this in our conversations as we go through on how the midwives had plugged in and recalibrated the way that they have worked during the pandemic. Muqaddas Sultana, I would like to invite you to share about your experiences, because you've been pivotal as well. You've had babies before the pandemic and during the pandemic. And let's start by asking you the first question that, you know, in your first pregnancy as a mother in India, were you adequately informed about birth in your first pregnancy?
I was not adequately informed by anyone else, but I self-taught myself because I thought it was my responsibility to be fully aware of the birthing journey I'm going to have and the life I'm going to bring into this world. So I went through a lot of websites like Birth Center UK and Spinning Babies, Mama Natural, all natural things and all natural stuff which I wanted to learn to be able to bring my baby lovingly into this world and being able to fully embrace the experience that I would have that day of my birthing. So I was not supported in any way by my doctors in that sense. But yes, I was fully aware, I was fully informed. Still, I had a cesarean, and that I think was very unjust on for me. I personally believe that even till this day.
were you given the information on why you needed to have a cesarean in your first pregnancy?
Yes, I was given the information saying that my baby had passed thick meconium, and that was the same excuse which was given to my sister-in-law about 7 months ago. And but that time my mother had stood there. She had to literally fight with the doctors and nurses, saying that how can you say that? You just said half an hour ago she has fully dilated. You try. I cannot compromise. I don't know anything else. So they said, please wait for some time. We will try. And then they delivered her normally. The same experience was repeating with me, and my experience was way worse than that, because my doctor, during my 7th month itself, she had told me, when I asked her that I want to try for a normal delivery. So she said, okay, after a few days you come, I'll do an internal check. And at the starting of 32 weeks or something, she checked and she said, it's very tough for you to deliver normally. I think you must go for a cesarean. I asked why, how can you know in the 8th and 32 weeks itself that I cannot have a normal delivery, I cannot go. So she said that nowadays there are a lot of lifestyle changes which women have gone through, and bodily changes, food and the intakes, all these contribute to what has happened with you. Already once during your 6th month, you remember that once you told that you are not able to feel proper movements. So I said, yes, I told you, but when I, drank warm milk, and after 1 hour, when I walked a little, I was able to clearly feel the movements. She said, no, this is your primary baby. You have conceived after 2.5 years. So it's not good for you to take any risk. Better you go for cesarean, because the due date, when your due date is falling, that is Eid time. Most of the doctors will not be there. If you go into labor at that point, it will be very risky for you. And I thought it was a very lame excuse on the part of a doctor, and especially when she knew that I was educating myself on a lot of things. And I was quite confused. And then at 33 weeks, when I went in with my scan report, she said, see, at 31 weeks or 2 weeks, what did she say was, I do not, my pelvic region is not wide enough to deliver a baby normally. This was the first excuse she gave me. I was like, how come? And I researched it online, or everything. I had a habit to, see it online. And it was like very rarely such cases happen where really women do not have a wide enough pelvic region where a child's head can come out. So I was like, I cried very bitterly, and I was like, am I among this rare genre of women? Why I had to be in this? And I cried bitterly. Then again in 33 weeks, she said, see, your baby is breech. So you cannot, anyways, you prepare for a cesarean, and you do one thing, go and take this injections, which will be good for your baby's development, lung development, something she said. Go and take those injections. And I again researched, and I was like, no, it's not good for a baby to, unless it's an emergency or kind of a situation, and where the mother is really into some big problem, or she really has a, some kind of problem where she has to get the baby out quickly. Unless and until that reason exists, those injections are very harmful for the baby. I am sorry, I cannot take your whatever you are suggesting. So she used to get angry. Otherwise she was a very friendly, quiet, calm doctor. But whenever she used to tell me such things and I used to oppose and take a stand for myself, she used to get angry. So I changed my doctor in the 9th month, and I went to other doctor and I got checked, and she said, who is the doctor who told you such? Nothing is such. Everything is quite normal. It seems quite normal. Your whole pregnancy, the whole journey is also quite healthy. You have no health issues. So you can try for a normal delivery. I said, okay, I will. But suddenly I came to visit my mother one night, and I just saw that my water was leaking, and I could not understand and comprehend what to do. I ran back to the same hospital because my file of 9 months was of there. And I went there and they checked, and the morning doctor said that I'm dilated, this and that. Then my doctor who was taking me, she came in and she said, Why are you trying for a normal for her? I already told that she should go for a cesarean. I said, why are you pasteurizing me to go for a cesarean? Why are you again telling me this thing? She said, see, your pains are not that much. Your pains are coming. Your water is leaking. Everything is okay. But it's quite tough to go for a normal delivery. She's trying to say all things unnatural to convince me. And what I did was I just got out of the room. The main thing about that hospital was they were not letting me move, not letting me eat anything. And they were continuously saying me, I went at 5:30 in the morning. And they were continuously till the afternoon telling me, don't eat anything, don't move, don't do anything. We might be, if we have to take you for a cesarean, then it will be very tough for us to do a cesarean if your stomach is full. And that was not just me who was being told so. The whole room, the labor room of around 12 mothers were being told the same thing. And they were doing whatever the doctors were advising. I did not listen. I went to the third floor of the hospital. I just told them I have to go and pee. And I got lost from that room. They were keeping on announcing my name. Where are you? Where are you? I did not respond. For 2 hours straight, I walked. And I walked up and down the stairs, the hallway of the whole hospital. And at that point of time, my pain started increasing. And I was going into labor. The doctor checked me and she said, yes, things are progressing. And that doctor, her shift suddenly changed and a new doctor came in. Till 10 in the night, they were saying, yes, we are going to try this and that. But see, your doctor previously, she advised, it's very tough for you to go for a normal. Better you go for cesarean. Every half an hour, they are telling me this. I don't know what happened. At the end of the moment, they said, you're a careless mother. You don't care for your child. You're very selfish. You're only thinking about yourself. And we are telling you continuously, see, your child's heartbeat is dropping. I said, how? Where is the heartbeat dropping? I know when we go into labor and the child comes down. So you have to also remove your device and check where his heart might be. Please do that. And they were like, as if you know a lot, you do your own delivery. And she just very harshly spoke to me. And the Daya came and she said, ये डॉक्टर ऐसा ही करते माँ, बहुत लोगों के साथ करते. आप एक काम करो, आप पुश करने की कोशिश करो. So doctor had just touched my leg and in a very rough manner, and she said, don't you know how to push? I told her, no one learns how to push from their mother's womb and comes. Doctors support, you tell me how to. She said, I'm telling you, but you're not able to understand yourself. Why are you being so selfish? And she told my mother, see, her child has passed meconium. Now, if you do not sign, I am not going to deliver. The main thing, then the most supportive thing was that my husband told me and sent me that if the doctor, even at the end moment of time, tells you that, tells you that she'll do perform an operation or a cesarean on you, come out, I will take you to Fernandez. That time, the first time I did not choose Fernandez, the main reason was that when I called the hospital and asked for the package, I was told a very high amount, which was not so. I don't know who I spoke to, but they told me around above 50,000. So my budget was not that. And this hospital's budget was quite low. So I thought, chalo, kahin pe bhi normal kya nahi hote, sirf thodi wahan par hote. Okay, let's try. But the experience I went through was very pathetic. It was very painful. And at that point of time, I was not in a position to get up and go to any other hospital, and no other hospital would take me at that point of time. I knew that. So I totally left it on the doctor and I cried while signing. And the most painful memory of mine was when she cut my stomach open. And before I lost my consciousness, she told me that, oh, see, your baby was so low. If you could have tried a little more, aapki normal ho jati thi.
I'm so sorry, Mukadas, because what you have described has been a traumatic experience for you. And the most important thing is it's practicing and how we practice. And that's the reason why we are starting to have midwifery in the country to practice evidence-based practices. And the landscape is also now changing. Doctors have been trained to treat. And whereas the midwifery philosophy is different. So today we want to celebrate Midwifery Day, and also how then, I'm going to invite my midwives, Sheetal and Anitha, with midwifery and with what Mukadas has described and explained what she's gone through. How was your midwifery training different, that you are now changing practices on the women that you cared for? Sheetal, would you like to take this question, please?
Mukdas, our heart goes out to you and to those moments when you really felt incapacitated and unsupported. But as for midwives, our philosophy is we support normality, we support physiology as much as possible. We do understand we have a 20% window where mothers could deviate from normality and where we believe in collaborative care. However, the autonomy of the mother, and it's not only her body, it's her body, it's her mind, it's her feelings, her experience, her memories, they matter to us. What you carry with you after that birth matters so much. So as midwives, we encompass all this, and we are specifically trained, we are specialized, and we would not look back to call ourselves as experts in normality. However, we do believe in multidisciplinary collaboration, but we support the mothers to follow their body, to follow their baby whom they know for 9 months, and to connect with their body and their baby, to connect and find themselves flowing through the birth. So the flow of birth is what we support.
No, thank you, Sheetal. And also the climate needs to change, because we need to listen to women's voices. And your second child, I mean, your subsequent pregnancy was then in the pandemic. We are now during the pandemic. This pandemic has been inevitable. We did not think that a year later we are in a situation, and in fact we are in a much worse situation. And as women, I will ask both of you these questions at one point. How was it for you? I will ask Anusha first, and I'll come back to Mukadas. How was it for you to actually feel, being pregnant during the pandemic?
I think being pregnant itself in the is a very interesting experience for a woman, and like you rightly said as you started off, that it's filled with joy but also a lot of anxiety. So having had the first child before the pandemic, and I was already 35 when I had my first child. So in an Indian context, I was really old at 35. So at 39, when I was pregnant for the second time, the first time was just obstetric care. I didn't know about, the midwifery care that I could access. So when I was pregnant for the second time, I was very happy. I was very sure that I needed a midwife, and you as my midwife started me off on this journey where I felt already a lot more in control of, the pregnancy. But I think the universe had separate plans, and the pandemic totally sort of put all of that into a chaos. So my first trimester was before the pandemic hit us, and I was really looking forward to the next 6 months, saying I'm going to be in your care, and less medical intervention, and felt so good. But the pandemic sort of unleashed a whole new set of anxieties, which truly nobody had the answers for, right? Like we were all struggling to understand what this pandemic is. And to be in a lockdown situation with no access to medical facilities, like I can't just walk into the hospital and say, you know what, I'm feeling little, though I have pain. Can you just check me? And all of this was just completely lost for a while. So I think I was reeling under this new, sort of a mold that we were put in. But however, I think just having, indeed to say, please don't worry, tell me what's going on. Okay, I think what you're going on is very normal. If this continues, get back to me. Because the entire lockdown, I couldn't access medical care. I couldn't access, I couldn't get my scan done. But through this, just having you by my side really helped me to say, okay, it's not at a position where we need to stress. So just take a deep breath and relax. But what really wowed me is that you were facing, and all your midwives and the frontline health workers are all facing this pandemic, personally, but you were there and still putting the woman in the center of her birthing experience is just, it really amazed me, because you could have clearly said, well, we are all facing this. I don't know. I have no idea what's going on with you. You need medical care, but you were able to recalibrate and still put the woman in the center of a birthing story in the pandemic. I think that really, kudos continues to go to, healthcare staff that are putting others in the center of and putting them in control, and especially mothers, because whether the pandemic is happening or not, women will get pregnant, women will have to birth, and how to recalibrate and still give that care and concern. And I remember when I came into labor, you as my midwife, and Teresa, who was there along with you as a midwife, you were masked, you had your PP, you had your all of your gear in place, but you let me be normal. You didn't say, you have to mask every second, because I was going through a lot of like pain during labor, but you said, okay, we are going to take utmost care. Do what you need to do to be in control of this birthing experience. So I think that really helped me during that time.
I would like Anita, one of our professional midwives, Anita, to share with everybody, how as midwives, what did we do to support mothers, and how was it for all of you as well?
Hi all. Actually, it was very different feel when we took care of the mothers during the pandemic. We supported the mothers by giving the one-on-one care, continuity of care, as well as triage system, where the mothers can meet like in the teleconsultation, and enough time for them to discuss. And we did not demise doing all the things for the mothers, like giving choices for the mother to birth in different positions, as well as respecting their choices. And even we are supporting the birth companion in the birthing place. In this way, we supported the mother by giving good care to the pandemic. Hope all the mothers who came during pandemic did not feel the difference of being like we are in the pandemic situation.
I think that's a very important message to mothers out there, because a lot of mothers could not bring their birth companion of their choice, and being pregnant during this pandemic is frightening. So it's important for mothers out there to know that they can bring their partners of their choice, and that's really important, because you need that to release your natural endorphins. And Sheetal, may I ask you as well, what are the things that we do? And it was challenging, but how did we support mothers with their choices?
Yes, that's something that we really focused on, to see that our mothers are not deprived of what they want to do during their labor. So the mothers who came, some of them wanted to have water births, and some who wanted land births. As Anita has said, that we gave them all the support we could on land, and keeping in mind the emerging evidence, and wearing our PPE, following all safety rules. But even for those mothers who wanted water birth, we kind of respected that choice. And we did support them by saying that we would have a screening for them. We would see how they fit into the criteria. And we had mothers who did have wonderful water births. And we had around 43 water births even during the pandemic. That was a very good thing. And with all safety rules in place, and as even Anusha said, she is a witness to how the midwives catered to her care without disturbing the birthing mother and her companion. We took care of ourselves, we took care of the mother, their food, their drink, their exercises, and their emotions. And we went forward with confidence that yes, as much as possible, we can keep close to the birth plans and to the preferences of the mother and the couple.
No, thank you. Mukudas, I'd like to ask you this question then. You've shared what you went through your first pregnancy, and in your subsequent, when you came in during the pandemic, how was the care different, and how did the midwives support you during this crisis and this period?
Pandemic, like Anusha has said, brought in a lot of anxiety, especially for mothers, because everything was ambiguous. Even the news, we did not know what to believe, what not to believe. There were news that few pregnant mothers are also contracting COVID. So, and then I had two of my younger kids at home who were only 3 and 1.5 at that time. So anxiety kicked in really hard, and I was trying to get in touch with the hospital. And like she said, the access was limited, but was much better than all the other hospitals of Hyderabad, which I am fully aware of. I had my other two cousins who were pregnant with me along, and both of the hospitals which they were showing in the common near to their homes, they both had shut down because they had got COVID cases and they were left stranded in between, nowhere to go. So that was not my situation, and I was quite relaxed knowing that my team was with me. But obviously the access was quite limited, and the anxiety really kicked in around 38 weeks or so, or 39 I don't remember. And I was feeling very uneasy, and I called the hospital, and they were very politely responding to me continuously. Each time I called, thrice I called, I remember, that ma'am, you just speak to about what is worrying you, but better don't visit the hospital if it is unnecessary, because it is not good for you. And that was quite relaxing for me. But at one point of time it kicked in so really hard, and it quite hard, because my husband that was also because my husband started getting some cold, and I was like, you are going to be my birthing partner, and if you have cold, they won't allow you inside with me. You get rid of that cold, you better get rid of that. And it was 2 days, it was not going off, and I was like, I can go into labor anytime, and I can't think or imagine of anyone else being my birthing partner other than you. So please. And it was not just going off, and somewhere that hypertension kicked in, and I ran to the hospital, and they checked me, and they said, ma'am, your BP is high, you need to get admitted, and we need to check you. They kept me, they didn't give me any medication, but midwife came and spoke to me, doctor came and spoke to me. It was quite relaxing, but also very, I can say, it kind of overpowered, because I was seeing many other mothers over there, and COVID situation, the hospital environment also has changed a bit. Everyone is speaking from far away, that physical contact was quite less, and that it was quite a bit different, but still it was quite needed for me. And then the doctor told me that better you don't go home, we'll try to induce you and try to get your baby delivered. So me and my husband were like, induce? I am a VBAC mother, and induction can go very wrong in case of VBAC, and we both were very well aware of that. So we said, please give us some time. We thought about it, and we said, sorry, we don't want to go for induction. I want to wait, even if it crosses 40 weeks, I want to wait and see whether I go into labor naturally, like I did last 2 times. And I just want to take a discharge and go home. So the doctor came very politely, she's asked, and even the midwife very politely, are you sure you want to take this decision? Because it might be that you're carrying COVID along with you back home. We don't know. So I was like, no, I'm very sure, because I don't want to go for an induction. The reason being, it can be quite, its consequences might be very hard on me, and I might not be able to accept another cesarean. I just want to go home. And they very politely, very wholeheartedly accepted it, though she came thrice to explain it to me, but she kept my choice, and she let me choose what I wanted to do. And that was very relaxing for me. That was very welcoming for me. And I thought I could not go to any other better place than this. And both of us signed a form. We walked back home.
Mukundas, I think you've really picked up a very important point of decision making together. So you, as a family and health organization, decisions needs to be made collaboratively, because it's your pregnancy. It is an informed choice, and it's good to know that you've actually highlighted that. you know.
Yeah,
Thank
that
you
was,
for that.
see, when I had, during my first pregnancy, when I had no problem and the doctor was continuously going on pasteurizing me for a cesarean, to this point where I really had a problem, I had this, also my test done for, what is that when we get, what we get due to high BP and all, preeclampsia.
Yeah.
So my preeclampsia profile was also done during that visit to the hospital, and that came normal, alhamdulillah. But that was done, and then I was being able to, you know, take my own decision, and I was given the freedom to walk back home, and that was so empowering for me, and that was something I really needed, I wanted, and that was, see, it's my life, my
Thank
choice.
you.
That is what I wanted from you all, and that was
So,
very empowering for me. Thank
and
you,
thank
thanks for
you.
that.
And this is how we need to change the landscape of pregnancy and caring for women in India. It's not prescriptive, it's holistic care, including the woman and her family. And Anusha, can I just ask you as well, what was your moment of anxiety at that point? What, you know, because you'd asked me a question, I don't know if you remember, because a lot of women out there are probably going to be feeling the same too.
So, you know, when heavily pregnant, I was sitting in your office with my partner, and the two of us were like, what if I end up as COVID positive? Will you be there with us through the end? I remember you just had that smile and said, of course, I'm there with you till the end. And it was so reassuring indeed that I almost, you know, told Rohit, my partner, that, you know, you're an amazing partner. I mean, it's I would want you in the labor room, but if I have to choose, please, be okay, that I would prefer Indie, because I'm very well taken care of. I mean, I just remember that was the moment I felt, you know, that much in confidence that, you know, I am in the right hands and I will be taken care of. And you were so accommodating to say, not just you, your partner is going to be part of you with this journey. And when I was rushed into emergency C-section, Indy, you were so, you know, with me till the end. And so was Rohit. It was just a beautiful experience to bring our child into the world, though it ended up as an emergency C. You know, I had all of these, you know, dreams of having a natural birth, but we tried till the end. We tried, though both my, you know, births were emergency C-section. The second time around, I felt much more in control of the process. And even after it happened, it definitely took me some time to understand that, you know, why was this a C-section and all of that. But you were there to say, we did everything in our power to see that it was a natural experience. And I remember, you know, as soon as the baby was born, you brought the baby to me, and she just came and suckled like she knows what to do. And that in some way righted all the wrongs that had happened in my first pregnancy, because I was away from my child. My child was away from me for 7 hours after he was born, and it put me into postpartum depression. And really, I think that it was such a harrowing experience. I felt in a way that even during the pandemic, having my partner Rohit with me, having you all with me till the end, and the child just coming to me, in a way, sort of righted many wrongs. And I think that's how care should be for a pregnant woman, where she and the baby are in the center of all of these stories, because they truly are the center of the story. And with midwives, that sort of naturally happens.
No, thank you, Anusha, because you have described something that most mothers out there would probably want to hear, that, you know, even if you are in theater, your baby can be brought to you and skin to skin, and
Yeah.
your partner could be there with you as well, which is really important. Can I just ask Anita, there's a lot of mothers out there that are probably feeling vulnerable, feeling, you know, what if, what's going to happen if I come to hospital and have symptoms of a cold? How can we reassure them?
Actually, when the mother comes to the hospital or when under the teleconsultation, we will try to assess the mother, like in which situation they are. And if they need, as it is our hospital is not a multi-specialty hospital, we try to see what situation they are facing in this pandemic, whether the signs and symptoms are there or not. Depending upon that, we may refer the mother to the physician, or we try to give an appointment to the mother so that they will meet the physician through the teleconsultation, or else they can come to the screening room and they can be tested. And depending upon this situation, they will involve the mother and will make a plan for them.
So just for the audience to know that, if mothers come in with mild COVID symptoms, we are not a COVID center, but we're not going to turn you away. It's just if mothers are symptomatic, then we advise them to go to a center, a multi-center where they have the right equipments. So just to reassure mothers out there, if you have COVID, it doesn't mean you should have a cesarean section. Again, the care is individualized with your consultant and your midwifery team. So it's important to note that. Sheetal, would you like to share anything else that you have done during this COVID period before we will share some videos of some mothers and reconvene and have the conversation again?
Yeah, I would like to share about the wonderful birthing positions our mothers opted for. So none of our mothers birth on their back, none in lithotomy with their legs pulled up. So most of them prefer upright positions, which is the right position physiologically for the descent of the baby. And we've had stats which say that most of the mothers birth standing or squatting, and many of them have taken sideline positions and they have been comfortable. There are many mothers who choose to bear down their baby in certain positions and take a different position when the baby is going to be coming out, and we support that. So that's one thing I would like to highlight, and we feel very happy about it. And it's like a jubilant moment in the morning during handover. What was the position the mother took during the birth? And we really enjoy that handover. And also we want to help you understand that many families have had their cultural values to be respected, and they have put that forth to us even during this pandemic. So as much as possible, we've tried our best to support those choices also. And we find joy when the families are happy, and they come anxious when they go overjoyed. And that gives us so much more gladness.
I think you've picked up on a very important point, and it's for everybody to remember that, owning your pregnancy and being prepared and joining in online childbirth education classes. Knowledge is power. When you know what to expect, the journey is going to be less frightening. What we're going to do now is we'll show you videos of our happy mothers thanking our midwives, and then we'll reconvene again with more questions.
Midwives, they have replaced my family during my delivery. They took care of me just like my mom. They gave me the homely feeling and the emotional comfort which was very much necessary at that point of time. All of the midwives, a very happy International Day with all due respect and love.
So by the time I had turned 33 weeks, my doctor had assigned me a midwife. And by the time I set into labor, though that particular midwife was not available on that day, be rest assured that at Fernandez, you'll always have an esteemed team of midwives and doulas who would assist you emotionally and mentally through your delivery. I would like to wish all midwives at Fernandez Hospital a happy Midwives Day.
And this is our little bundle of joy. I gave birth to this baby boy 10 days ago. I would like to thank all the team of midwives and doula who helped me deliver without any medical intervention.
Thank you for getting us through this.
I have a baby boy who's about 9 months old. My delivery wasn't an easy one, especially my labor, which lasted for about 40 hours. And I can't imagine how I would have sustained the journey without the support from the midwives who took care of my comfort, care and emotions. I would like to thank them all and wish them a very happy International Midwives Day.
Midwifery concept was very new to me until I met them for the first time during my 32 weeks of pregnancy. They have built confidence to trust myself and my strengths. They have treated me with respect and gentleness. I wish you all a happy International Midwives Day.
24 hours of my labor journey went very smooth with the support of a midwife. I cannot imagine my labor process without the help of a midwife. Starting from feeding the food, helping me doing the exercises, more than all that, filled me with a lot of positivity. For all the midwives out there, thank you so much. and happy International Day of Midwives.
I would like to wish all the wonderful midwives a world full of happiness for all that they do. They say that it takes a human with a heart full of love to be a midwife, and I can't thank all the midwives who helped me deliver my beautiful baby girl back in the year 2018.
Hi, I am a second-time mom to be. I would like to wish all the midwives a happy International Midwives Day. I would actually like to thank the midwives who supported me during my birth, and it was a wonderful experience going through the whole process. It was all smooth, and the support that we get from the midwives was outstanding.
Hi, this year the International Day of Midwife has its theme, Invest in Midwives. We at Fernandez began to invest in midwives way back in 2011. Over the years, our midwives have enjoyed the privilege of helping 11,000 women birth. I want to thank all you women who continue to come to us believing in midwifery care. Thank you.
Prashanti's asked a question saying that this is her first pregnancy and she wants to try for a normal birth, but sometimes she feels so anxious about how her experience is going to be. Can there be programs like Birthing Without Fear, which I can attend? Also, she has gestational diabetes in the 7th month. Can she still birth normally? Sheetal, would you like to take this question?
Yes. Prashanti, thank you for venting out what you feel inside. And yes, though you are feeling anxious and you look forward for programs, we do have online childbirth education classes going on. And we have a set of 4 classes and you can register for them. And we have wonderful educators who are Lamas trained and they can allay your fears. You will be there connecting online with many couples and many moms like you are in, and you will be able to feel relaxed. However, if you still feel more anxious, you could went out to in the midwifery clinic when you come, if you feel free to, and we could, if you are willing, give you an appointment with a counselor, and which also would be helpful. And though you have gestational diabetes, there is every possibility for you to go through a normal labor, though a birth plan would be made along with the medical team and you to know how the sugar control is. So looking at all that picture, we will be able to take you forward.
Thank you, Sheetal. Pooja has asked, and she's 19 weeks and she's got swollen feet. What's the remedy for it?
Nothing to be worried. At 19 weeks, she can be just home remedies. She can do her walking and do the normal things, what she has to do. It's only the thing is like sometimes it's in the later pregnancy, there are chances of the BP to raise with the swollen feet. There might be some indication, but at this point of time, she can just keep a pillow under her legs and while she's sleeping. And whenever she gets some time, just walking and continuous sitting or continuous standing may lead to this type of situation. So these pillows as well as walking can help her. When she has a visit, like initially she can have a checkup on her BP levels in between if it's a nearby clinic, or else if she has a BP apparatus, at least once in a week she can do that. If there is any changes or if the BP is increased like more than 140 by 90, then she can come to the hospital or she can have a teleconsultation.
Thank you, Anita. Vijeta has asked a question. Is there any harm for pregnancy, mother and baby with COVID-19? I'll take that question, Vijeta. A year ago when COVID started, the research was there was a minimal transmission from the placenta. But the latest research have shown that in pregnancy, and if mothers have COVID, the chances of preterm labor increases. So it's still ongoing and the research is still changing. In some countries, they have advised pregnant mothers to have the vaccination. Whereas in India, it's still under review, and the MOHW, it needs to be the one to endorse. It's a personal choice, and it's for women to be informed and make that decision and see the healthcare professional. It is an important decision. So you've asked a very valid question. Please do not self-prescribe yourself and self-remedy. If you are not well, please see a physician. You can do that virtually, and it's important to do so. There is a question. I'm very new to the term midwifery. Will we be automatically allocated to a midwife in Fernandez, and will the same midwife be there throughout the birth journey?
Midwifery, if you're new to the term midwifery, a midwife means with women. So we are there in Fernandez for the women who come to birth with us. So we do run clinics through the week. And when our mothers come, the low-risk mothers are free to come and seek a midwife's appointment directly. Or also if they come to the doctor and they are low risk, they are channelized towards the midwives. So the automatic midwifery care is your choice. You can come and ask the doctor, you need to see a midwife. Our doctors also, if you're a low risk, they do transfer you to the midwifery care. And the continuity is carried on surely by the midwife, but in a way where we would not be able to promise that the same midwife would be there during the birth. We do take a team consent because it depends on what shifts we are and how we are catering to other moms. So all our midwives in the team are trained the same way. We believe in the same philosophy. We give the same kind of care. So that it may not be the same face, it may not be the same midwife, but the care will surely be the same and the quality would remain.
I think that's so fundamental, I think, for women out there to know that midwifery works in large volumes and how you have impacted. We'll show you some slides on what the impact of midwifery care has been as well. But I would like to ask Anusha, if there is one message out there to the mothers who are listening, what would your message, your take-home message be for them?
I would say that if you want control on your own pregnancy and your birthing story, have a midwife along with you, especially midwives who are trained like they are at Fernandez, because they will put you in the center of your birthing story. And that's really important for you, not just for you to have a good story of the birthing, but also your own confidence with yourself and your child. And it remains for the rest of your life. And to all the midwives there, wishing you a fantastic International Women's Day, Day of Midwives, but also to say that you're doing such amazing work. Thank you for being with mothers and for being part of their stories, and good luck to all of you.
Thank you. And Mukadas, what would your one message be?
Yeah, I would like to really thank all the midwives from the bottom of my heart for being there for us always, and also giving us the chance to be courageous enough to think for ourselves, because that's a very important empowerment which you pass it on to us, and you let us be what we are, and you let us take our own decisions, and you let us focus on ourselves. And that is very unlike what we usually hear at home or from other people. So you usually, midwives sometimes go even beyond family, and more than the support we get from family, I feel we get from midwives at the hospital, because there are few negative things which keep coming up during the pregnancy from even the people who support us. But when we come to you, you never make us feel that way. You always give us positive vibes, hope in ourselves, hope in what we want to achieve. We can. So that is a very important support and care which we really look for and frantically search for all around us, and it's very easily given at Fernandez. So that's a very valuable thing for us mothers. Thank you. Thanks for that.
Thank you so much for this. Anita, there's a mother called Shravanti. She's saying that she's 34 weeks pregnant and midwives are still not associated with me. What can she do?
She's always welcome to have the midwives. Actually, she can directly come. If she's coming to the Fernandez Hospital, she can have a midwifery appointment and she can talk to us and she can discuss all sorts of things, whatever she wants. what all doubts she has, she can clarify with us. We are always there for you, and we will help you out to come to the normal and natural process. And it is a collaborative care. Wherever you are in need of a doctor, we will see that you meet a doctor also. So be happy, and we welcome you. Whenever you come, you can just directly take an appointment and you can just meet us.
Sheetal, somebody's asking, what's the difference between a doula and a midwife?
Okay, that's quite much in the FAQs all the time. So we are very happy to have doulas with us. We work as a team, though we have different roles and responsibilities. So starting with a doula is to give you all the support, the informational support, the physical, the psychological support, the physiological support, nutritional support, okay, and advocacy support as well. That's what the doula does. Also, and she's trained for all those massage techniques and the way to take you forward into your labor process. A midwife is also trained for all this. She also stays with you throughout labor, gives you all the support, but she also has additional responsibilities of clinical decision-making, keeping your documentation, updating the multidisciplinary team with what is happening, and being able to make a decision along with the mother and the team for how the labor goes forward. So that's the distinction. But at Fernandez, we work wonderfully, doulas and midwives together, and we try to be at our best for our mothers and their families.
Another question, a 30-week pregnant, and she's anonymous in this question, but she's just asking about what type of birth plan to choose. I think you've answered that, Sheetal, in the childbirth education classes would empower her to choose the birth plan. Someone is asking, like, she's got a bicornate uterus and had a first scan, and can she have a normal birth? She's 27 weeks. Does she have to prepare herself for a cesarean section? It's on a left horn. We have collaborative care. Anita, maybe you can share the times with birth mothers with bicornate uterus. Maybe you can reassure Swati.
Swati, nothing to be worried. See, your labor will decide whether you are going to have a normal or not. So 27 weeks, nothing to be worried. You can be relaxed. And we have birthed mothers with different type of uterus or with problems, and even fibroid uterus or bicornate uterus. There is no problem. We are there to support you. When it's nothing to, like, just from now at this type of pregnancy, when you hear about this bicornate uterus, you might be worried, but we are there to support you, and we are there to help you when you come to the birthing room. And the birthing process and the labor process will decide whether you are going to have a normal birth or C-section. So
thank you. There's a lot of questions out there about the vaccination. So just to share, internationally, the vaccination has been advocated. The RCM and the RCOG have advocated that pregnant women should make the choice, and the vaccination should be offered. FIGO has also endorsed that. In India, the MOH, Ministry of Health and Family Welfare, needs to endorse that. So I urge you to go and lobby and get going and ask for the vaccination. But currently, we are not giving the vaccinations in India at the moment. So I hope that's asked your question. For Tanmay, she has severe pain in the hip bones while sleeping due to sciatica nerve pains. Will this affect her pregnancy? She's 29 weeks. And who can she also be referred to help with the sciatica?
Okay, so we do understand sciatica pain may be really painful during pregnancy, and especially in the nights, the pain emerges out to be more. But first of all, to ease that pain, you need, of course, you would need a physiotherapist to go to, and we do have physiotherapy services in Fernandez. Okay, but temporarily, what you could do is you could take some warm compress, and you could apply some olive oil or coconut warm oil light massage. Do not apply any balms or any Wolveran gels or Volini gels, okay? Because they, the research says they are connected to reducing the amount of fluid for the baby. So we recommend that you don't use all the balms and gels that are medically available. So go naturally. For temporary pain relief, you could, as I said, use warm compresses, use oil massage, and position yourself in lateral positions with help of pillows, and take a lot of amount of pillows that you need, and good positions that are comfortable for you. Tuck in a pillow in the under the tummy so that your body alignment is maintained, and do see a physiotherapist. If your pain is excruciating, you would want to see a physiotherapist and get help.
Thank you, Sheetal. So it's important to share. Anusha asked, how did we recalibrate, and shared what we did. We are seeing mothers face to face, but we are trying to limit the times the mother comes into hospital. What we're trying to do is, if you need to come to a scan, then you club it with another appointment, and we also offer virtual appointments. But you need to be mindful that if you're concerned in any way, you're not alone. So you can contact us at any point in your pregnancy. So the midwives have continued to offer evidence-based individualized care. I think that's important. We know what Mukadas has shared in her first experience. So there's a lot of evidence-based practices that can also continue despite having COVID. And we work closely with the team, and if there's deviations, we have collaborative care. And that's really important for all of you out there to know that it's a team. And Sheetal answered that, we respect birth preferences, companion of choice, and we continue to offer hydrotherapy and water births with an initial screening to make sure that you don't have a temperature first. So 43 water births during the pandemic. I'm really proud of our midwifery team, because a lot of other places have stopped supporting that choice of birth. And we know that hydrotherapy and water birth reduces your need for an epidural analgesia. This is something that the midwives, they have brought up the skin-to-skin contact from 87% to 91%. And that's what Anusha had also shared that she'd experienced even in theater. So it's important to know that evidence-based practices should continue. And so we've done that. And just to share how much births that the midwives have done. So the total births supported by midwives, 1,784. The positions they have continued to offer. And some of you, I think Anusha remembers the gym ball and swaying with us, supporting her. And there you go. I just want to give you a few messages to mothers, and I'm going to ask my team to do so. Mothers, if you feel that there is a change in the pattern of your baby and you're not sure, if there's any changes, contact us. We may minimize you coming to visits, but if there is a concern, let us know, because we are there for you. Don't be afraid to think that you'll get COVID. We are taking all the necessary precautions, and it's important for you to feel heard. And one message as well from a lot of you are feeling lonely. Some of you are isolating alone at home. You need to look after your perinatal mental health. We have done some consultations with some mothers who are in isolation, and you need to remember that try to practice mindfulness, try to have self-care, eat well. The most important thing is don't watch the media before you go to bed, because it's just going to be running in your mind. You need to have a good night's sleep, and your healthcare professional is available to talk to you. Don't be alone, don't be vulnerable. Sheetal, any message to the mothers out there?
On this day, I really want to say that I'm proud to be a midwife, and so are all my colleagues, because we are able to be with you. So we believe in woman-centered care, and we are there to cover you and take care of your birth journey, your childbearing journey, every time you face it. So I want you to feel confident and step in, ask for the appointment of the midwifery clinic, and visit us. We'll be happy to cater to your needs. Thank you.
Anita, your take-home message.
Actually, I want to congratulate and wish all my colleagues happy International Day of Midwife. And one more thing, for all the mothers, we all are there to take care of you and support you in all the aspects. And we are going to give the choices for you, and we are going to respect your choices. So feel free to come to Fernandez and meet us, and we will support you in every aspect, even your emotional well-being and everything. So be happy and meet us.
And I would like to take this opportunity to thank our two mothers, Anusha and Mukadas. It's all about you, your experiences. And as healthcare professionals and midwives, we need to listen to women's voices. Women's voices are powerful and the way to go and change the landscape of maternal health in India. If you have any other questions, you can contact us on email. It's there, midwifery-care@fernandez.foundation. And on that queue, it's 12:01. Thank you so much, everybody, for joining us. And happy International Day of the Midwives. Namaste, and I'm happy to be here in India with all of you. Thank you so much.